My name is Dr. Steve Heinz. I am the medical director at the Wound and Hyperbaric Clinic at the Medical Center of Aurora in Aurora, Colorado. My specialty is emergency medicine, and I did that for approximately 31 years, and I have been in wound care now for over 6 years. Well, I registered, I guess, at the Desert Foot conference. It was at that conference that I was put into contact with Travis Tompkins, and he's the one who really arranged for the virtual training to take place. He took care of it all and sent me a thumb drive that we used for the training. And then we were able to open the kit and look at it while we were watching the thumb drive training. It was really very straightforward. We felt very confident using the materials provided after we had gone through the training. The actual procedure itself is very simple. It requires one of the medical assistants drawing blood and doing the preparation. The actual application was surprisingly simple. I thought that because you were dealing with a blood product, it would be potentially extraordinarily messy. It was not. I've been very surprised and pleased with the ability to apply a dressing at the time of the application and not having to change that dressing for 1 week. We have used the product on the same patient, and it went well every time. It was simple to do. All it required was drawing some blood from her. And I think she was somewhat surprised with the ease of the application. I don't think she found it painful at all, other than just a needle stick for a blood draw. She had a very complicated wound following a below the knee amputation and a failure of the muscle flap used to cover the surgical site. The patient is a diabetic and has some vascular compromise, which complicated her healing. And I felt that this was going to be a very challenging wound, which it has proven to be. And fortunately, ActiGraft has really helped her in the healing process. Within the first week, we were seeing changes in the wound that were positive. The wound has been responding to the ActiGraft applications as I had hoped. And again, I want to emphasize that this patient's wound was a very difficult wound to heal. And we needed to get this wound to heal because the only other alternative that we had for this patient was to convert her from a below the knee amputation to an above the knee amputation, which is a huge quality of life challenge for a patient. So we really had a challenging wound, and I believe ActiGraft has helped us to meet that challenge. I'm choosing ActiGraft for several reasons. One, it utilizes the individual's own body mechanics for wound healing. It is easy to obtain blood and apply the product. It's, for all intent and purposes, painless for the patient. And in this day and age, maybe as important as anything else, it's very reasonably priced. And in our patient population, that is a really important factor. There are so many different products out there that you can utilize. I believe that ActiGraft is as good, if not better, than any of the products that I have used to assist in wound healing.